Careers in sports medicine. Introduction to the module. The sports medicine sector is a very crucial and lucrative sector to build up a career in, and hence this module will go through the various career options related to sports medicine. Topics to be covered: chiropractor, exercise physiologist, fitness instructor or personal trainer, massage therapist, therapeutic massage therapist, nutritionist or sport dietitian, orthopedist, physical or occupational therapist, podiatrist, sports lawyer, sports medicine physician or medical doctor, sports psychologist, strength and conditioning coach. Chiropractor. Chiropractors are specially trained to use their hands to heal the joints and muscles of the body. Chiropractors help people with low back pain, sports injuries, and other health issues involving the muscular, nervous, and skeletal systems, especially the spine. To become a chiropractor, one must first earn a doctorate in chiropractic degree and pass 4 national board exams. In addition, an aspiring chiropractor must receive licensure in the area in which they want to practice. Additional tests are thus required for this licensure. Exercise physiologist. Exercise physiologists study the acute and chronic physiological responses of physical activity. Their goal is to improve health, fitness, and performance. Traditionally, exercise physiologists worked only with athletes. However, today's exercise physiologists also work in commercial, clinical, and other professional settings for the general population. The minimum requirement of being an exercise physiologist is an undergraduate degree. Fitness instructor or personal trainer. Personal trainers and fitness instructors usually work one-on-one with clients in their homes, the trainer's office, or a fitness center. Personal trainers are typically hired as independent contractors and are paid by the hour or per session. A personal trainer should have a good background in anatomy and kinesiology at the very least, and ideally, an undergraduate degree in a science-related field. Massage therapist, therapeutic massage therapist. Massage therapists use structured pressure, stress, motion, or vibration to the soft tissues of the body to alleviate muscle tension, spasms, inflammation, fluid retention, aches, stiffness, and pain. Massages also improve circulation, both blood and lymph, general flexibility, range of motion, tissue elasticity. Massages can help with injury healing by limiting scar formation. A massage therapist may obtain certification via state exams after completing a massage therapy training program. Massage therapists can work as instructors in sports rehabilitation medicine or fitness or spa facilities. They frequently serve as support for professional athletes or teams. Nutritionist or sport dietitian. Dietitians investigate dietary habits in order to avoid illness and improve health. Dietetics is the science of nutrient intake and food use. This scientific discipline connects food and nutrition to health management. Dietitians operate in a variety of settings, including hospitals, clinics, sports centers, school districts, and public health facilities. Private clients or sports teams may also employ them to create proper diet plans for weight loss, weight gain, success, and health maintenance. Orthopedist. Orthopedists diagnose and treat disorders of the bones and joints. Because of their knowledge of the functioning of the musculoskeletal system, orthopedists often treat sports injuries and sometimes serve as the primary physician for athletic teams. An orthopedist is required to complete a 1-year internship in general surgery, 4 years of training in orthopedic surgery, and a year of medical practice before taking specialty board examinations. Physical or occupational therapist. Physical therapists help patients recovering from accidents or illness increase their mobility, alleviate pain, and avoid or restrict permanent physical disabilities. Before being eligible to practice, one has to be a graduate of an approved educational program and must pass the appropriate licensure test. Physical therapists operate in hospitals, clinics, or private offices that have specialized equipment. Patients can also be treated in emergency rooms, houses, or schools. Whereas a physical therapist assists patients in recovering from injury or illness, an occupational therapist focuses on the improvement of fine motor skills and dexterity. Following a 4-year undergraduate degree, most occupational therapy schools require 2 or 3 years of specialized education. Podiatrist. Podiatrists specialize in the diagnosis and treatment of foot, ankle, and lower extremity conditions, which account for a significant portion of the human skeleton. The 52 bones in the feet make up about 1/4 of all the bones in the human body. Podiatrists need a license that requires the completion of at least 90 hours of undergraduate study, the completion of a 4-year program at a college of podiatric medicine. In most countries, a postdoctoral residency program of at least 1 year. Sports lawyer. Lawyers represent clients in courts of law and other forms of dispute resolution. Sports attorneys, in particular, manage athlete contract agreements and detail writing, evaluating services for a variety of results, endorsement, sponsorship, licensing, media contracts. They also manage personal injury lawsuits, defamation litigation, and worker compensation claims. Sports medicine physician or medical doctor. Sports medicine physicians are highly trained in the diagnosis and treatment of sports-related injuries. Most professional teams employ sports medicine physicians, whereas other physicians are employed by clinics or hospitals. A physician interested in sports medicine normally seeks specialized training in sports medicine, orthopedics, cardiology, or other areas. Sports psychologist. Sports psychologists study the psychological factors associated with participation and performance in sports, exercise, and other types of physical activity. Specifically, a sports psychologist helps athletes use psychological principles to achieve optimal mental health and athletic performance. In most cases, an undergraduate degree is a principal requirement for entry into this profession. In addition to obtaining a degree in psychology, one should also acquire national certification. Strength and conditioning coach. Athletes' workout programs are developed and monitored by strength and conditioning coaches. Their aim is to increase and boost an athlete's power and success. A strength and conditioning coach is often needed by high school, college, and professional athletic teams. A master's degree, as well as appropriate certification, are normally required for employment in this area. Strength and conditioning coaches must complete the Certified Strength and Conditioning Specialist program. Summary. In this module, we have covered the following. Chiropractors are specially trained in healing the joints and muscles of the body with their hands. Exercise physiologists study the acute and chronic physiological responses of physical activity. Fitness instructors, or personal trainers, typically work one-on-one with clients either in their home, the trainer's office, or a fitness facility. Physical therapists help patients recovering from accidents or illness increase their mobility, alleviate pain, and avoid or restrict permanent physical disabilities. Sports psychologists study the psychological factors associated with participation and performance in sports, exercise, and other types of physical activity.